Off the Chart was created really as an expression of gratitude and trust for nurses. It is a campaign that is really bringing a level of attention and action to making sure that we address and stem the loss of our nursing expertise that's currently in our workforce.
Nurses really bore a lot of the brunt during the COVID pandemic and before and after. And nurses are really leaving the workforce in record numbers. We've lost 100,000 nurses during the COVID pandemic, and about a third of nurses are considering leaving the workforce even now.
By 2030, we will lost 2 million years of nurse expertise. 1 in 2 nurses leaves the profession by their second year.
When I hear people talk about the nursing crisis, I really think it's important to frame it as a healthcare crisis, because when we don't have nurses in all the places with all the expertise and types of care that we need, none of us is safe. Vicki Sims really heard the stories and saw what nurses were experiencing, and she reached out to me and she said, "Can't we do something?" And I said, "Absolutely, we can do something."
So we have partnered with 3 different medical systems. One is UCLA, the other is Keck USC, and City of Hope, to appreciate the nurses by giving them a $10,000 gift with no strings attached.
Each hospital system chose a very diverse group based on the off-the-chart attributes, which include things like a bias towards action, originality and creative instincts, and the potential to achieve even more.
We are so delighted that you've joined us here this evening for a celebration of nursing greatness in the inaugural year of our Off the Chart campaign.
Off the Chart nurses are a kaleidoscope that radiates the scope and the depth and the power of nursing, and beautifully reflects how nurses provide expertise across all conditions of health, all stages of life, and at all points of discovery, translation, and delivery of our life sciences.
I am not aware of any other program like this. Nurses are grossly underestimated and widely unseen by a lot of the healthcare practitioners and healthcare providers and healthcare payers. And it's time that we invest in nurses.
When we don't invest in our nurses, we lose important expertise.
I learned from a very early age that when you're lost in the wilds of America's healthcare systems, you really need nurses to show you where to go.
Every walk of life can be changed by the nurses and their expertise.
I never thought that I would receive this recognition for the work that I'm doing every day.
Gifts such as this is definitely a way to help nurses understand how valued they are in the community.
It's really going to take a village to help solve the nursing workforce crisis and really the healthcare crisis. And so we're hoping that other foundations and philanthropists will use Off the Chart as a roadmap to support nurses within their own communities and health systems at whatever level they can.
We're so grateful for the 3 partners that we have, and we're looking forward to having more join us.
Yes.
We are eager to do more. This is Off the Chart. This is a campaign that we put together. It's a playbook for anyone to use. We invite you to iterate off of it, improve it, outdo us, go for it.
So if you're in leadership, make room for nursing expertise, and then where everyone is, there's something that they can do.
If you have a mission or a mandate to improve health or human experience, you need nurses, you need a lot of them, and you need them wherever healthcare decisions are being made.